Medicaid's prior authorization system is under intense scrutiny, and for good reason. Imagine needing permission before getting a specific medication or treatment, only to face delays or outright denials that could jeopardize your health. This is the reality for millions of Medicaid enrollees, and here's where it gets controversial. The process isn't just slow, it's often shrouded in complexity and inconsistent enforcement. But here's the twist. Recent federal and state reforms are trying to fix the system, even as critics argue they fall short. Let's dive into the numbers and ask, do these changes truly protect patients, or are they just window dressing? And this is the part most people miss. The real battle isn't just about faster approvals, but about empowering enrollees to challenge denials effectively. Ready to unpack the data? Let's go.
Medicaid Managed Care Organizations, MCOs, serve 75% of all Medicaid beneficiaries nationwide, yet their prior authorization policies, where they require approval for certain treatments or medications before care is delivered, have sparked fierce debate. While intended to ensure care is both medically necessary and cost-effective, these rules often backfire. A 2023 report by the U.S. Department of Health and Human Services Office of Inspector General, OIG, found that Medicaid MCOs denied 12.5% of prior authorization requests, double the 5.7% rate in Medicare Advantage. Even worse, 89% of enrollees never appeal these denials, and only a third of those who do succeed, compared to 82% in Medicare Advantage. Why the gap? Limited state oversight and confusing denial notices, which often arrive too late or use jargon that leaves patients baffled. As one enrollee might ask, if I don't understand why my request was denied, how can I fight it? A Biden administration's 2024 Interoperability and Prior Authorization Final Rule aimed to streamline the process, cutting standard approval times from 14 days to 7 by 2026. But here's the catch. 18 of 36 surveyed states already required faster decisions, while 18 still lag behind. Meanwhile, the Trump-era 2025 initiative, where insurers pledged to simplify prior authorization, faces skepticism. A recent KFF poll found 73% of adults view insurance-related delays and denials as a major problem, with few believing insurers will follow through. Is this cynicism justified, or is there room for hope? The answer may lie in the details. Key findings from the 2024 KFF HMA survey reveal a patchwork of state policies, decision timeframes. Half of responding states now require MCOs to decide on standard authorizations within 7 days or faster, aligning with federal mandates set to take effect in 2026. Yet 18 states still allow longer delays. Denial notices. Only 32% of states mandate electronic denial notices, despite evidence that mailed notices frequently arrive late or not at all. Clearer, standardized language could help, but OIG found even templates sometimes omit critical info like how to request a hearing. External reviews. At least 38% of states offer independent medical reviews after MCO denials, a step that could boost appeal success rates. Medicare Advantage automates this process, contributing to its 82% overturn rate versus Medicaid's 36%. Why the disparity? States aren't required to provide this option, leaving many enrollees in limbo. The stakes are high. Federal rules allow MCOs to restrict services based on medical necessity, but the line between cost control and patient care is thin. For example, a diabetic patient might need insulin, but an MCO could argue it's not medically necessary. Without proper documentation, external reviews aim to prevent arbitrary denials, yet only 15 of 39 states currently offer them. What happens in the remaining 62%? Patients face an uphill battle against opaque systems. So where does this leave us? The data paints a mixed picture. Progress is being made, but gaps remain. For instance, while 21 states use standardized denial templates, OIG warns these can still lack vital details. And, though the 2025 Insurer Pledge promises faster approvals and clearer communication,
public trust is low. Here's the big question. Can voluntary commitments truly address systemic issues, or do we need stricter federal mandates? We'd love to hear your thoughts. Do you think these reforms are enough? Or is Medicaid's prior authorization system still broken? Share your perspective below.